Part 2 of diabetes mellitus, Dr. Bulam Onsawa Makago. I discussed the definition, signs and symptoms, causes or predisposing factors, complications of diabetes. Today we are going to learn about type 1 diabetes. Type 1 diabetes has almost the same presentation as type 2. Briefly, we can discuss about the most common complication of diabetes mellitus that is common in diabetes type 1, though it might also happen in type 2. It is the whistleblowing symptom for those ones who are not sure of their diabetic status. So when you feel the symptoms, rush to the hospital for checkup. We can identify it through a clinical presentation, which I'm going to discuss in this video. We can also do a urinalysis where we will see ketones or ketone bodies in your urine. This is because your body cannot get enough glucose because it is saturating in the blood and it is not reaching the tissues. So it resorts to breaking down fats. And when the fats are broken down, there will be another chemical produced, which is ketones. Ketones are dangerous to your body, they are acidic. So the liver will also release the stored glucose. It will also accumulate. Remember, there is dehydration for people who are diabetic because they are over urinating. There is dehydration, there is ketones in the body, there is excessive glucose in the blood, causing a condition called diabetic ketoacidosis. This is also very dangerous and can even cause unconsciousness. Common in people who usually miss insulin shots. So make sure you don't miss your insulin, and when you take it, make sure you have eaten as instructed by your physician. When you have diabetes, it puts you at a risk of developing a blood clot, and this will damage your heart or your brain. It might even predispose to hypertension, which might lead to cardiovascular accident or stroke, chest pain, and heart failure. As discussed before, there is retinopathy, there is nephropathy, peripheral nerve and blood vessel damage. Complications of diabetes type 1 in pregnant women include high birth weight, complicated cesarean section, early deliveries, stillbirths, preeclampsia, and birth defects to the baby. The best way to prevent complications is keeping your blood sugar lowered, eat well and exercise regularly, reduce weight if you're overweight, monitor blood pressure and cholesterol levels, take care of your feet and teeth, have regular checkup to your teeth, your feet, and your eyes. Other symptoms of type 1 diabetes include unexplained weight loss, heavy labored breathing, mood changes, bedwetting in a child who has not been wetting the bed. Then the following are the dangerous signs or symptoms, and when you see them or notice them, just rush to the hospital. Confusion or shaking, rapid breathing, fruity smell or breath, belly pain or abdominal pain, and sometimes unconsciousness. Treatment, as we said, it is insulin only. Type 1 does not respond to oral anti-diabetic drugs. You just have to be on insulin for all your lifetime. If you want to reduce the risk of diabetes, avoid smoking, reduce alcohol intake, regular exercises, drink enough water to nourish your body, eat balanced diet. Next time we shall discuss the ketogenic diet. Some of the challenges is hypoglycemia, and it is common when someone has taken the insulin shot and takes long to eat, or when he has fasted for longer without food. It can bring the symptoms of hypoglycemia, which may include drowsiness, visual disturbances or blurry vision, confusion, headache, weakness, sweating, and many more. Thanks for watching. Don't forget to subscribe. Dr. Bulam Omusawa Makago.